Welcome to the Ask Brian podcast radio show, where you'll hear from some of the most successful founders and CEOs of businesses and startups, sharing their best advice for success and even some stories on how their mistakes actually make them even more successful. Now, here are your hosts, Brian and Tracy.
Welcome. You're listening to the Ask Brian radio show on KHTS 1220 and 98.1 FM.
When I was a younger person, everybody used to tell me, and I'm not that old, by the way, everyone used to tell me Brian is spelled B-R-Y-A-N or B-R-I-A-N. So why in the world would you have a show called B-R-I-E-N, and we have our co-host, Tracy, who's going to explain to this audience why in the world people are spelling Brian with an E?
Yes, I'm going to explain with an E as to all of the fabulous reasons E plays a great role in this show. And one is our engineer. And her name is actually Emily. So we want to send a shout out to Emily, our engineer, who makes this show possible. And it's really all about education. It's about empathy. It's about excitement. What's excitement or what's empathy? Funny you should ask since you have none.
What's wrong with being selfish?
Well, I think that, every host and co-host has their roles, and I am the empathetic one, and you are the one that's not empathetic. So we'll just leave
I thought it was because Patrick, our first engineer, he wears like a size 14, and I wear a size 9, and I figured I could, he can't fit into my shoes. So obviously he can't.
But he was just always trying to get you to metaphorically walk in his shoes so you weren't so, I can't think of an E word for that.
Arrogant, pompous or arrogant.
Yeah, those aren't E words. How about we talk more about the types of guests we have on Ask Brian, where we have experts who are highly educated, who allow us to educate entrepreneurs in ways that they can shortcut their learning curve. And we do that with enthusiasm. Yes, exactly.
Let's get excited.
Yes, and we are very excited. And
now the neighbors are calling us and saying, what's going on?
Yeah, you're going to get evicted. And you're going to get evicted.
Another E.
Another E that nobody wants. So without further ado,
how do you spell ado?
A-D-I. This always gets me because I'm afraid I'm going to spell it wrong. A-D-I-E-U.
You've been on the Sesame Street of business for a while now. You should figure it out.
Yeah, I know. It's just that it's like I feel under pressure. Like like you know how to spell it, but then when you're standing up in a spelling bee, you might just forget how to spell it. But A-D-I-E-U, without further ado.
Well, great introduction, Tracy. Tracy's our co-host. She puts up with this every week. I don't know how, but somehow I must be paying her a lot of money or something.
Yeah,
but
the
anyway,
big bucks, the big bucks.
You're making so much money, you're probably going to have to give up your day job. Anyway, without any further ado, we have a very good guest, and in terms of E on education, he's got quite a bit of education, probably a little bit more than a kindergarten person. His name is Muri. Is that how you pronounce your name? Muri, M-U-R-I?
Yeah, that's correct. It's very phonetic.
Cool. Well, very good.
Beautiful.
Gorgeous name. We have a couple questions for you. So first of all, what is your background?
So my background, I'm a neurosurgeon based in Los Angeles. So I'm a physician, but also I'm a tech entrepreneur. I also have my background in public policy. So I have my MPA from the Kennedy School. So I look at healthcare from all sorts of angles.
So you've got a lot of
education. I was born and raised in Ghana, but I moved to the States when I was 15 years old.
Wow. That's quite an accomplishment to be coming from a foreign country, come over to the U.S. and be going and getting that degree. I mean, that's like brain surgery. Wow.
That's right.
If you ever did brain surgery in my brain, you'd be lost. Like, what the hell is going on?
No, anyway,
yeah, we interesting to see what's up in there, right?
There's a lot of wires forced all over the
see what I see up in there. I bet you Tracy wants to see it too.
No, I just know it would be the fastest brain surgery ever.
We're not talking
It's like
lobotomy.
the whole meme with the tiny brain inside of the big head, Homer Simpson's brain.
No, we're not having very much empathy.
I'm kidding.
You have a fine brain.
Anyway, so you have this company. What is the name of the company?
It's Talamus.
Have you started?
Talamus. Talamus.
And that's a .com on the internet?
Yeah, there is a .com on the internet, www.Talamus Health. You have to add health to the end of it, .com.
TalamusHealth.com. And did you start the company yourself, or did you have other people that started it with you?
I started myself. I started this a few years back, trying to solve some of the challenges in healthcare.
And what is the company? What does the company do? I mean, obviously it's healthcare, but what do you do? I mean, you're not doing brain surgery, are you?
No. It's not brain surgery. It's actually a digital health platform, basically a marketplace that brings, providers together with patients. Patients can find the help they need, and providers can provide the help that patients need. So we have several different kind of people on our platform. So this goes for patients, goes for clinics and doctors, also goes for labs, imaging centers, as well as pharmacy. So basically everybody can come onto our platform and offer what they have, and patients can find help that they need.
So is it like a patient portal or
yes, so we have several, yes. We have several aspects to it. So our target market currently has been emerging markets. We have started with Africa, but we plan to go to Latin America and other places. Essentially, on the continent of Africa right now, I'll say more than 99% of healthcare access points are analog, as in they're still pen and paper. So there's a lot of information asymmetry. It's really difficult for patients to find what they need in a timely manner. And when it comes to prices, there's also a lot of asymmetry and a lot of mystery around what pricing is. So we are going around and doing digitization across the board. And that is, we are helping pharmacies go digital. We're helping hospitals go digital. We're helping labs go digital. We're helping imaging centers go digital. And we have a patient app that kind of covers all of that. So a patient can find, query an inventory for any pharmacy and find where the medication they're looking for actually is in stock, and be able to find out about pricing, and maybe even pay from their phone. They can do all this from their phone. They can make appointments with clinics. They can make appointments with labs and get their results back. So they can do all sorts of stuff on our platform. So that's what we built. So basically, we are helping everybody go digital. We are creating basically like the Amazon of healthcare, essentially on the continent.
Well, that's a pretty big plans you got there. I mean, Amazon is not exactly a small company.
Well, they started small. So.
Well, that's true. I think they started with books. Question is, so are you focused on the patient, or are you focused on the pharmaceutical companies or the insurance companies or the physicians? Where's the focus?
So our ultimate goal really is centered around the patient. But when you go to a new space like healthcare, where you have so many different verticals that need to work together, and they're all pretty much pen and paper, in order for the patients to have a digital access to them, you have to digitize those places as well. So while our ultimate goal is the patient, we needed to go and also build the ecosystem by digitizing all of them. So for now, our focus is also not just the patient, it's also helping the pharmacies, the imaging centers, the clinics also go digital. That way the patients actually have an easier way of getting in touch with them and interacting with them in a digital space. So yes, for now, we are doing all of that. But eventually, as our ecosystem we get the network effect and ecosystem matures, our focus is going to be on patients, giving more access to cheaper medicines, access to cheaper healthcare, access to all of that.
So how do you deal with HIPAA? And I'm presuming you're familiar with HIPAA. How do you deal with HIPAA requirements and patients there?
Yeah, so we have built our platform to be HIPAA compliant. Not only because it's a requirement, because a lot of African countries and even emerging markets don't have a well-defined rules the way we have with HIPAA. But for me, when I look at HIPAA is a matter of principle, right? You don't have to do it just because you're required to do it. You have to do it because it's a morally responsible thing to do. So if you're handling anybody's healthcare and you're expecting a patient to come and trust your platform, it's the only thing on you to make sure that whatever they put on there is very protected. So the laws don't have to exist for you to do it. It's just good business. In addition to being a moral thing, it's just good business, right? Because a platform like ours, one of the most important currencies is trust. And once you break that trust, your company is going to fail. So we don't need law to do HIPAA. We actually go beyond that to make sure that patient information is protected.
And what kind of systems do you have in place to protect that? I mean, every site, even Experian and the big, huge corporations, I hear about these data breaches. So, I mean, how do you protect that?
Yeah, I mean, obviously, we're not going to sit here and say that, we are the most, how do I put this succinctly? I'm not going to sit here and say that we can never, ever be hacked, right? But we have put everything in place to make sure it's hacked, that it cannot be hacked, The idea is our data is AWS-based. We have put a lot of security. Data is encrypted on the way to and at rest and in flight. Our data is encrypted. Every organization that comes onto our platform signs a BAA agreement with us. The patients also, we have put things in place like, if someone logs into your account on a new device, you get an SMS message, for example, to alert you of it so that you can take action right away. We make sure you change your password from time to time. So we put a lot of things in place, to say the least, to make sure that the information is protected.
And where are you generating revenue from? Is it from the patient, from the pharmacy, from someone else?
It's from the providers. So pharmacies, labs, imaging centers, in hospitals and clinics. So patients get to use the platform for free. Okay.
So it's a free service. So anyone...
Yes, I mean, obviously they have to pay for the medication. If they buy the medication, they have to pay for the medication. But we don't charge them to use the platform.
Now, so for instance, that's a good example. Just on a drug example, right? Let's say you get the XYZ drug. XYZ is very popular, by the way. So I'm getting the XYZ drug. Is it going to go out and find me the best price?
Yes, so that's one of the things we do is, as we bring pharmacies onto our platform and onto our inventory system, the patient is able to really query those closest pharmacies to them, one, to find out if they have it in stock to start. Once they know that the place has it in stock and they'll have a whole list of places that have it in stock, they can tap on it and actually see the actual price, right? And so they can do price comparison and decide based on various factors how far it is from them, how many of the medications they're looking for the pharmacy has, and based on that, make a decision which pharmacy to request the medication to. So yes, there is transparency in both in availability, but also in price.
And how does that coordinate, though, with the insurance, right? So, for instance, obviously, I have Anthem insurance. Now everybody knows they can hack the system, get my cards. Anyway, so I have Anthem insurance, and let's say, and now you know that I'm taking the crazy drug. So now everyone knows I'm insane, and I'm using Tracy's Pharmacy because Tracy's Pharmacy is a really big company. How do you coordinate all that? Because first I thought that the pharmacy, in order to determine price, needs to check your insurance to see what coverage you have, to see what the price will be based on that. Yeah. So when you say pharmacies, are they including the benefit that you have on your on my crazy insurance from Crazyville?
Yes. So one of the things we've done actually on our platform is that we have price lists. So when the particular pharmacy comes on, they're able actually to upload all the prices, that price arrangements that they have with insurance companies. So you, as a user, if you put in your insurance information, it's actually pull that price list for you to be able to see that instead of seeing the regular price, for example. So that's one thing. So we have that feature. But the other thing also is that in the markets that we currently are, the insurance space, especially the private insurance space, is very nascent. As in, you look at a place like Nigeria, for example, less than 2% of the population have any kind of insurance. And the majority of those are getting it through the employees. So there's a vast number of people who still, do healthcare through out-of-pocket expenditure. And that's a big issue, right? Up to 70% of people actually do out-of-pocket for any kind of healthcare stuff. And this leads to about 1 in 10 Africans every year, for example, having a catastrophic healthcare spending, which kind of basically puts them into poverty. So this issue of price transparency and availability is quite important, especially from the patient's perspective, since a lot of them are really actually paying out of pocket. So the insurance issue hasn't become a big issue yet on the continent, but the growth of the insurance market on the continent of Africa is, I think, is very, very important to see growth in that space because it's going to really help people avoid these kind of catastrophic spending going forward.
So, for instance, I'm an American, and many Americans are buying drugs from Canada or from other places because the drugs are cheaper. So, if you're from Nigeria or Ghana or somewhere else, will it allow you to do that, or do you have to buy it only specifically in that specific country?
Well, I mean, there are regulatory, each country's regulations are different. So there are definitely some regulatory barriers, and also there's logistic barriers, right? I'm sure quite a number of Africans buy medication directly from Canada or somewhere without any issue. But the issue is the logistic side of it, on how do you actually ship it to them and all of that. From our end, one of the things we have been trying to do to actually eliminate this issue is that, a study that was done by one of the pharmaceutical companies indicated that by the time the medication leaves the manufacturer and gets to a typical, to a patient in Africa, the markup can be anywhere from 40% all the way to 700%. Just imagine that.
Wow.
Even almost 7x of that amount being so because there are so many issues around the logistical chain that each person that is participating in that chain has their own little profit margin to it. So one of the things we are trying to do is to shrink that space so that the markups are also reduced, and that way it doesn't hit people's pockets as much, so they don't need to go looking outside with all the potential nightmares. Because remember, if you order from abroad, and you could be a fake medication. For example, 20% of all medicines in Africa, by the WHO, says that about 20% of all medicines in Africa are fake. So if you're buying something from some other country, you have no idea if you're getting the right medication. So the proper way to do it is really reduce the markup so that the medications that are coming into the country that are vetted medications, that we make sure people actually getting good medication, not fake medication, at an affordable price. So that's part of the work we're doing is shrinking the distance between the manufacturer and the patient so that you don't have so much markup and people can afford it.
Tracy, you have some questions?
Yes, thank you. So everything about this business is so interesting and timely, especially around a global pandemic. Before the break, Peter was asking in terms of how has this pandemic affected your business model, the supply chain, and just the general perception around the healthcare industry as a whole?
So it's quite interesting because I think we've had sort of the two sides of the effect. That's in the negative and the positive effects from COVID. On the negative side, when, as with everybody else, we really didn't expect sort of this thing came on so suddenly. And the kind of public health initiatives that many countries were taking was also quite sudden. For a while, we had to shut down operations on the continent because a lot of countries actually took a much stricter restrictions than we even saw here in the United States. So we in some countries went as much as 4 months without really going out there to do anything, from actually getting pharmacies onboarding and all those things. So that was the negative gave us it. But, since I opened now and we're back in the field and doing all of that. So that was set us back slightly. But, something interesting happened because, for a while, people were so used to being pen and paper and not digital, and they were kind of comfortable in that space. What the pandemic really showed is the need for digitization of the operation. So what we are finding now is that the conversation is quite different. If you approach a pharmacy or a hospital now to talk about going digital, they're not looking at you like you have two heads. It's more like, okay, let me see how this can help me, because now we realize that we really have to change the way we're doing business. So now we're getting a little more inbound and a lot more referrals than we did before the pandemic. So the initial negative, now pretty good. So that's on the side of the business side. From a logistics point of view, obviously, everybody knows we are now, even here in the United States, we're feeling the effects of the logistics across industry. And certainly, you can find that in the medical field as well. A lot of pharmacies are struggling to keep their shelves stocked. And also, they also lost a lot of medication, a lot of revenue during the pandemic. So we are looking at ways to help them with that. So we've had conversations with financial service companies to help them actually restart some of the businesses. So we're looking at creative ways to help with that. Eventually, I think the supply chain issues will be resolved. But the way to actually, dampen some of these effects, because we could have another pandemic going forward, is to actually sort out demand forecasting. Be able to actually track the inventory and do demand forecasting so that you're saying, okay, in the next 6 months, we expect this kind of demand for this kind of medication or this kind of medical equipment in this particular area, and then kind of have sort of the advance notice to order the necessary kind of medication. And it's also good for suppliers, because suppliers now can also use that kind of data to predict where the needs are going to be and to start planning out their own logistics to be able to deliver these things.
Wow. So you're basically saying that the pandemic was not necessarily a detriment, but was really an asset to the growth of your business.
Yes. I mean, in the beginning, it set us back, but I think now everybody sees the need for some of these things, right? So the conversation is definitely different now.
And how about in terms of going to the next level? So if you could talk a little bit about where you are right now in terms of how the business is operating, the amount of members you have on your team, and then in taking that to the next level, what are some of the hires that you would need to make to be able to scale your model?
Okay, great. Thanks for that question. So our approach is, in each country, we build a team, right? So in Ghana, we have a team, and we have a very, very smart and competent leader, country lead there, who's doing a lot of work. And as with any startup, everybody's doing everything. But I think we have to say now that we need to start demarcating and hiring more people to help them. They've done an amazing job. The same with our leader in Nigeria, has done an outstanding job as well. And I'm deeply indebted to them. But, they need help. And so our plan is going forward to raise funds and obviously bring in more executives. We have proven the business model. We've proven people want our product. Now it's time for us to really go into the market and really, really, really go hard to get us to the level of scale that allows us now to do some of the other stuff. So, because when you're building the marketplace, you have it target, right? So you have it staged. For example, we have focused a lot on bringing clinics and pharmacies and imaging centers onto our platform. We haven't really done much aggressive patient recruitment. We've been onboarding patients passively through the clinics we are signing. But at some point, we want to turn our attention to the B2C model. And to be able to do that, we need to scale the provider side of things. And that, sales cycle can be a bit challenging. And you need more people on the ground to be able to do that, onboard them, train people, do those kinds of things. So we do need to hire people, and we need to organize our team around those people that we hire so that we can be aggressive in the market and build the ecosystem.
And where do you see the funding coming from that? Is that something that you're going to fund with the revenues that are generated within the business, or are you going to be seeking outside funding?
Both. So we have post-revenue, but we do need more money. As with any business, even if you're post-revenue, we are early post-revenue, you're still going to have, a time where you have to still move yourself to your break-even point before you start seeing profit. And to get to that, we need to hire people to push heavy in the market. So we are in the process of actually fundraising, and we are also in an accelerator that is doing a great job in helping us organize all of that, which is Expert Dojo out in Santa Monica, and they've been fantastic so far. And so we do plan to raise and build the next unicorn on the continent.
I love that. So when you're talking about the team side of scaling, and then putting those people in place, that also leads to what I would imagine would be a pretty strategic marketing effort as well. How do you see this business being marketed? And because especially if you're looking at getting more involved in the B2C side, where do your marketing efforts, where are they going to be allocated, and how is that going to be achieved?
So we are doing obviously, like I said, we're taking a target approach. So the marketing for the different constituents within our customer groups is going to be different, right? So for pharmacies, we use a lot of organizations and a lot of referrals because a lot of pharmacists and pharmacy owners know each other in the markets that we operate in. Same with clinics. So we go to the organizations, we do some of the direct walk into the the clinic and talk to them. But we do a lot of stuff through the organization. We do newsletters. For example, during the pandemic, when our people couldn't go out into the field, we organized seminars on Zoom on healthcare topics to get our name out there and get people familiarized with who we are and what business we do and those kinds of things. So we do a lot of those kinds of things. We go to the conferences. We present at conferences. On the C side, once we start to fully, pay attention to that, we've looked at many ways. We've looked at partnerships with telecom companies because, telecom companies are drivers of a lot of things on the continent. We currently have a partnership that we struck with a major telecom company that we are working with. We do things through social media. Believe it or not, WhatsApp actually is a good marketing medium in Africa, believe it or not. And we do a lot and we plan to do things like billboards and things like that. And of course, also the hospitals, right? When people go to hospitals, to have them say, hey, this hospital is on our platform. You can actually interact with them. You can do telemedicine with them. You can book in-person appointment with them in the future. You can make your payments on that platform. And then we have insurance companies we're also speaking to. So we are taking many avenues to reach the patient going forward.
Tell us a little bit more about the WhatsApp marketing, because that's not something that comes up a lot on our show, and I know our listeners would love to hear more about how that's working for you, and maybe even some tips, behind the scenes tips, if you will.
Yeah, I mean, we haven't done a lot of it, but I actually have I have friends in other sectors who have effectively used WhatsApp marketing. There's a lot of forums on WhatsApp, and people forget that, and a lot of businesses that actually do a lot of business on WhatsApp. I think people get paid on WhatsApp. And that's the case on the continent, right? And I think WhatsApp actually has been building out business features for that very reason. And it's because, you're basically entering a community of trust. So you have a forum of 4,000 people, and you have somebody who's actually active on there that people know about, saying, this is my experience with this product. Because they know that person and trust that person, it's almost like they influence the same, but in a very not filter, without the filter, if you will, without the Instagram filters. It's actually more authentic, I think, because often those are people that they've been communicating with each other for a long time. And so that's one avenue. I'm not saying it's the only avenue, but it's actually a fairly effective avenue, I think, for a lot of people who have used this, and we intend to use that as part of our potpourri of marketing channels and things like that.
Interesting. Yeah, that's a platform that doesn't get mentioned a lot, so that's a really good tip. Are there any other marketing things that you're doing that you feel like are innovative outside of the WhatsApp?
Well, one of the things we've done also is to break down our product into little pieces, right, and allow people to kind of slow walk it. So if you are a clinic who's like, I'm not sure we're going to go fully digital, we say, well, can you start using our appointment system, right, to start? And then we upsell them and say, okay, now that you like the appointment system, how about this other stuff? It could help you with your operations. So that's also another avenue we'll be using is that's more of a technical way, but not to tell people that they have to ingest the entire platform right away, but to do it piece by piece, which is quite interesting because on the continent, when you look at how people pay for their phone, it's not a monthly like here. It's actually you buy data or you buy, data for a certain period of time. And when you run out, and you just buy another one. So people are used to that kind of pay as you go kind of model anyway. So we try to leverage some of the existing way that people are used to paying for stuff in marketing our stuff as well.
So who would you consider your competition in the space?
So we have, because we are such a very wide horizontal platform, we have quite a few competition in the different verticals. So we have companies doing EMR that are competition. There are companies doing inventory and supply chain for pharmacies that are competition. And those will be probably the two main ones that we see on the continent. And they vary depending on the country we are in. But they're all great companies. So Africa has 1.2 million people. We are basically not even the first inning when it comes to digitization of healthcare on the continent. So I see it as them all as potential collaborators, because the work ahead of us is enormous. So while on paper they may seem like competition, actually we think they're collaborators because we have 1.2 billion people on the continent that we need to figure out a way to get better healthcare to. And for me, the way I see it, with the other companies who are hit, they are potential collaborators because the work ahead of us is massive. And there's space for multiple unicorns to be built on the continent around healthcare because the problems are that enormous. They're that big, and the opportunity is that big as well.
Right, definitely. Well, and I love what you were saying, too, about tiering people into your program and starting with the appointments and then moving them into that. That's a really great growth strategy. So transitioning from being a neurosurgeon to an entrepreneur, what would you say is maybe the biggest challenge that you faced and the biggest reward that you faced in doing that?
Okay, well, I'm still a neurosurgeon. I still practice neurosurgery. But entrepreneurship is just a whole different ballgame, right? It's hard. Entrepreneurship is hard. But it's doable if you really are passionate about this thing. My mother suffered a stroke a few years ago. It's really the genesis of why I started this company. So for me, it's a deep thing for why I'm doing this. And if you really believe in what you're doing, you make it happen. So it is hard. There are challenges every day. You are going to have some wins and you're going to have some failures. And recently I've had some of our challenges and things that we didn't do so well in the beginning. But then you learn. You learn and you innovate and you change and then, you get traction and then people start believing in what you're doing. So we are happy with the process and I'm certainly not the same person I was when I started because I know a lot about tech now than I ever did. I know a lot about how do you put a team together. I mean, putting the team together in healthcare is a bit different from putting the team together to run a tech company. And so I've had to learn that, and I built a lot of relationships in the process. So it is tough, but it's doable, especially if you're mission-driven in what you're trying to do.
That's
of course,
so
you
amazing.
want to make money for your shareholders as well. So.
Yes, and maybe have a little less over for yourself one day.
Yeah.
So how can people get in touch with you if they want to be involved with Talamus Health, if they want to sign up, if they want to get in touch with you personally? What's the best way to continue this conversation with you?
Yeah, so it's Muri, Muri, at TalamusHealth.com. TALAMUS, Health, HEALTH.com. Muri is MURI. So Muri at TalamusHealth.com. Or you can reach us at people at TalamusHealth.com.
Thank you very much. You're listening to KHS 1220, 98.1 FM. That's a wrap. See you guys next week. Bye.
All right. Thank you. Thanks for having me. Appreciate it.
Thank you for tuning in to the Ask Brian radio show. You can listen to us every Thursday on KTHS AM 1220 and FM 98.1 or via Facebook Live or anytime wherever you listen to your podcasts. Visit AskBrian.com to join the conversation and ask us your business questions, and we'll answer them on our next episode. That's AskBrien.com.